We're almost 2 years into this thing, the pandemic. We've lost almost 30,000 Ohioans to COVID-19. When all of this first started in March of 2020, when cases started popping up sparingly, then it's like, boom, wow. You throw a rock, you're going to hit someone who has a story about COVID-19, whether they want to share it or not. In the beginning, it was children, right? That was the message. Children, they're not going to get this, and if they do, they'll be fine. They're young, they're healthy. Well, we've seen countless stories where that really isn't the case. They get it, and it does have a severe impact on them. Joining us now is someone who knows a lot more than than I do, and that is Dr. Michael Bigham from Akron Children's Hospital, and he's the Chief Quality Officer and Pediatric Intensivist. Is that right, Doctor?
That's correct.
All right.
That's correct.
What do we know right now about children and COVID that we didn't know before? Because it seemed as though before it's like, oh, if your 7-year-old gets it, they'll be fine. But we're starting to see these stories now where there are some young children, young adults as well, that they get it and they're not fine.
Yeah, so I think the story behind COVID-19 is really that of it's almost a microbiology story. It's an evolution of a virus in a society, right? And so the very early strains of COVID-19 were, fortunately for children, were not as impactful to child health. We saw very few hospitalizations, very few positive cases, and so we were relatively relieved by that. There are too many other illnesses that disproportionately affect young children, and these initial strains or initial strain of COVID-19 didn't negatively impact kids. And then, sort of the next dominant strain was the Delta variant, and up until a couple weeks ago, the Delta variant really had become the leading strain of COVID-19. And what we saw with the Delta variant is we saw a much greater impact on kids. So we saw more kids with symptoms. We saw more kids testing positive for COVID-19. We saw more kids coming to our emergency departments. We saw more kids hospitalized. And so we saw a Delta variant of COVID that was really impactful, so much so that over the last several months, there's not a day that's gone by where we haven't had many kids in our hospital with COVID-19. Almost every day, several in the intensive care unit, and so that was a different experience with the Delta variant. And now we're sort of staring down the throat of the Omicron variant, which is the next leading strain. And we know within Ohio and nationally that Omicron variant is spreading very rapidly. And if we look at the South African experience, there were more children impacted requiring hospitalization with the Omicron variant than previous variants. And so we haven't necessarily seen that here yet, but we're anticipating that we may.
Yeah, and should our 5-year-old children, should they be getting the COVID booster shot right now, doctor? Because a lot of people are on edge. If there's the option for it, should children get it?
Yeah, well, the booster recommendations are variable, so it requires you to be at a specific age for a specific vaccine to be permitted to get a specific booster, and you also have to have been at some duration out from your previous initial vaccines. And if you'll remember, it wasn't until the last month and a half or so that those 5 to 11-year-olds were even allowed to start getting their initial vaccines. And so most of those kids are not eligible for vaccine boosters yet. And quite frankly, they aren't even approved based on their age for boosters yet.
What about masking? Should the schools, was it a smart idea for a lot of them to lift their mask mandates? Or would it be more safe for our children to be in K through 12 right now masked up still?
Yeah, so I think, I think we have the good fortune in some circumstances that most schools are out of session right now due to holiday breaks. And so I think it'll give school districts a chance to rethink their their policies or approaches around masks. And what we know first around the Delta variant and certainly around the Omicron variant is that if these are contagious variants, they're quite contagious variants, and there are both symptomatic and asymptomatic kids that are sharing this virus, and adults that are sharing this virus. And so all of those very initial preventative measures they still matter, they still work. Masks, hand hygiene, distancing, those things all still work. So I think schools are going to have a real opportunity to relook at some of the decisions they made maybe 6 weeks or a month ago to reduce or lift those mask mandates, and I think they're going to have a chance to relook at that before kids go back to school in the first of the year.
As a hospital, is Akron Children's Hospital preparing for a possible wave after the first of the year, after all of these Christmas gatherings?
Absolutely. Quite frankly, we've been preparing for a wave since March of 2020. And, as we mentioned, we were fortunate not to see a wave with the initial variants, but we got a wave of both pediatric patients in our offices and our emergency departments, as well as our inpatient units. And if the Omicron variant behaves locally like it has elsewhere, we may need to prepare for yet another wave of pediatric cases, particularly coming into our hospitals. And so we're preparing for that. We're anticipating that. We have a number of strategies to manage increased volumes and increased demands on whether it be outpatient services or inpatient services.
All right. Dr. Michael Bigham, Chief Quality Officer with Akron Children's Hospital. Thank you so much. Thanks for everything that you do on the front lines, you, the nursing staff that you have, other doctors, and even the sanitation crew. You guys are out there making sure the hospitals are safe, and there's a lot going on right now, and you guys have braved this for as long as you have, and I just really wish people would really start to believe that there are some consequences to getting COVID-19 right now, because I got cussed out yesterday for putting a story out about the Omicron variant. I'll tell you that right now, Doctor.
Well, thank you for letting us share the message, and happy holidays to you, and importantly, a safe and happy holidays to all your listeners, and important attention to all of those safety measures over this holiday season, keeping your loved ones safe as well.